Hi, my name is Jenna Guma, and I am from Rowan School of Osteopathic Medicine. My project today is on eating disorder education in medical students. Eating disorders can affect every body system, leading to osteoporosis, infertility, heart disease, and even death, to name a few. Early detection is key in the treatment and management of the disease, and it is associated with improved prognosis, yet more than half of all eating disorders go undetected. Almost 20% of anorexia nervosa patients will die within 20 years if they go untreated, and they face the highest premature mortality rate of any psychiatric illness. Those suffering from eating disorders need to be understood, helped, and supported, but first they need to be detected. The question arises, do doctors feel competent in doing so? Are medical students being educated in how to properly diagnose eating disorders? My research was based on personal experience in college of how common eating disorders were and how many individuals were battling them in secret for years after never having been diagnosed. The objective of this project was to identify the competence, comfort level, and ability of medical students with regard to eating disorders and to examine the gaps in medical education in this field. We hypothesized that with each subsequent year of training, medical students will become more familiar with terms and score higher on knowledge-based questions. We conducted a cross-sectional study to assess how competent medical students feel about the topic of eating disorders. We asked their familiarity with basic terms, knowledge-based questions, and asked about their past experiences in this field. A 19-question survey generated on Qualtrics was sent to deans of medical education and departments of psychiatry in osteopathic and allopathic medical schools throughout the country. Familiarity with basic terms were analyzed quantitatively on a Likert scale. 3 knowledge-based multiple-choice questions were scored. Mean scores were analyzed based on year of medical school and education using ANOVA. The total number of respondents was 287, ranging from 19 medical schools across the country. Participants were asked 3 knowledge-based multiple-choice questions that had 1 correct answer. These questions were adapted from board-style questions that can be found on common COMLEX or USMLE-style question banks. The questions asked respondents to correctly identify which eating disorder a patient had, expected diagnostic findings of a patient with an eating disorder, and a control question. They were awarded 1 point for each question correct for a maximum of 3 points total. With each rising year of medical school, students on average score higher on these questions. This can be seen on Figure 1. Students were presented with 5 different eating disorders and asked how to indicate how familiar they felt with each term using a Likert scale. They were able to choose 1, not familiar at all, 2, slightly unfamiliar, 3, slightly familiar, 4, moderately familiar, or 5, very familiar. For each term, students became progressively more comfortable with the terms the more years of medical school training that they had. Participants were most comfortable with the term anorexia and least comfortable with the term orthorexia. This can be seen on Figure 2. Students were asked how many hours of training on eating disorders they received during their first and second year and were allowed to choose from 1 to 10 hours. 89% of students received 4 hours or less of eating disorder training by the end of their first 2 years of school. Students were asked if they felt there were gaps in their not training in the topic of eating disorders, and 64% of third and fourth year students responded yes. Respondents who reported there were gaps in their knowledge were given an opportunity to explain, which can be summarized as lack of training in the following areas: eating disorders overall, treatment options outside of inpatient care, how to counsel a patient if you suspect an eating disorder, there is sufficient didactic training but not enough clinical training, how to identify patients with eating disorders, clinical complications such as refeeding syndrome, disordered eating outside of anorexia, how to counsel a pediatric or adolescent patient, and more training in nutrition in general. In summary, with each subsequent year of medical school training, students become more familiar with the terms anorexia, bulimia, binge eating disorder, and body dysmorphic disorder. With each subsequent year of schooling, students scored statistically higher on knowledge-based questions. 89% of students received less than 4 hours of didactic training in eating disorders in the first 2 years of medical school. 64% of rising third and fourth year students felt there are gaps in their training on the topic of eating disorders. Reported gaps in training included how to talk to a patient when an eating disorder is suspected, how to talk to younger patients, and treatment of eating disorders. Respondents also indicated a lack of knowledge on how to approach eating disorders in a clinical setting. In conclusion, more research should be completed regarding medical education and curricula on eating disorders. More emphasis should be placed on the diagnosis and treatment of eating disorders in the clinical setting. This should include training on how to approach and have conversations with patients when an eating disorder is suspected. Further research in this topic can look at medical education across primary care residencies and the utilization of screening questions in practice. Special thanks to Dr. Olson, Dr. Garnier, and Dr. Steer for their invaluable mentorship on this project, and to the medical schools who graciously sent out this survey to their students. Thank you for watching. Please reach out to me with any questions.